I'd like to welcome you to the Youth Mental Health Panel discussing challenges in our community. We've got a great list of 6 panelists here today to speak on various elements of the mental health process and advocacy from the Fraser Valley perspective. Before we get started, though, it's with great pleasure that we welcome you to the traditional unceded territory of the Stalo Nation and this beautiful Aboriginal gathering place. Our 6 panelists today are David Bain, Clinical Coordinator, Fraser East Early Psychosis Intervention Program; Karen Copeland, founder of Champions for Community Mental Wellness; Tia Noble, Department Head, UFB Counseling Services; Tasha Couture, Youth Advocate; Paul Enns, Team Leader at Abbotsford Youth and Mental Health; and Trish Lewis, Student Counselor, Sardis Secondary. So without further ado, please welcome our panelists. Question 1, what led you to become interested in mental health or to become a mental health advocate? Question 2, what do you feel are the greatest challenges we face in the Fraser Valley regarding youth mental health? Question 3, are there any unique challenges faced by our youth that are different from other regions in the province? And finally 4, what improvements are required for us to better manage youth mental health issues in the Fraser Valley? So, without further ado, let's give a big hand to our panelists. And starting with you, Tia.
Testing. No?
Yeah.
Are we all good? Okay. I just want to acknowledge that I was really honored to be here as part of this dialogue and conversation. So although we have quite a structure of kind of going through our questions, I really think the most powerful change and what we can do together today is to ask and have reciprocal conversation happen today. So I think that will be really important. So just a little bit more about myself, because I think it's important to know who I am, because that will color my opinions and my thoughts. So my dad and my sister were supposed to be here today, and I'm scanning the room. I don't see them. But my sister actually works here at UFB in the Disability Resource Center. So her and I both come from a background of having this innate drive to help and support people. And we both kind of stepped into the space of mental health and specifically with youth. And so for me, it's an honor to be here because on a day where it's very focused on well-being and physical health, mental health is such a crucial area that needs to have energy put towards, and I believe it is. I believe there's more strategies being developed, there's more acknowledgement of how important mental health is in the big umbrella of well-being. So my interest in mental health, when I had to think about that question, it took me back to a very personal, intimate friendship. And I used to call this gentleman my adopted grandfather, because I didn't know my grandfathers very well. And so he's passed away now, but he did a lot of work with the Mood Disorder Association. And he said once to me, he did this comparison, and he would always say, we don't expect somebody with physical challenges, say a broken leg or a broken back, to make their way to the emergency room or make their way to a place of support. But yet, sometimes there's that assumption that with people who have mental health problems, mental health disorders, they should be able to navigate the system, or if you put it in the terms of the physical situation, to have someone with a broken mind or a mind that isn't too stable, we can't expect them to make it on their own to the resources. We need to be there to guide them. So that stuck out for me when he said that. I couldn't help, as I got immersed in the university setting, to feel a real drive to be part of a mental health strategy. And again, I go back to this idea of general well-being being integrated into all levels of our culture, of our community, of schools, of families. So I'm going to kind of transition into the first question around what are the biggest challenges facing us in terms of youth mental health in the Fraser Valley. And so the biggest one that came to mind as I was thinking about this was this kind of the anxiety, the level of anxiety, the level of stress that we all seem to be facing, but it's becoming more prevalent in our youth. And them coming in to, you know, whether it's in a counseling office or in a classroom, and coming in and expressing this overwhelming feeling of anxiety and stress. And there's something about that leads me to think of the bigger picture of what is it about developmentally and progressing through childhood, through the teen years, through adolescence to adulthood, where there's so much stress and pressure and anxiety. So I think it's not unique to the Fraser Valley because UFV in spring 2013 participated in the National College Health Survey Assessment. And so some of the stats in that assessment really showed that anxiety is high, even, you know, within our school systems, within our university systems. So for me, when I think about the biggest challenge, I think, how can we address this anxiety, this stress, this worry that's just accumulating within a lot of us? How do we address that collaboratively and together? I think something that is unique, and when I kind of dug into the stats a little bit in preparation for this, not a lot of numbers, I'm not a numbers person, but with that survey that we did reflecting the university community, one of the things that stood out, which differed a little bit from a comparative of all the 32 institutions that were surveyed, was that here in the Fraser Valley at UFV, we had, it was asked participants in the last 12 months, what are the factors affecting your academic performance? So students were asked this. And 29.4% of them said that anxiety was a huge factor, impacting their brain, impacting their intellectual development. Stress was 37.5%, sleep issues 24.4%. And then this is the one that stood out for the Fraser Valley, was work. 22.8% of UFB students surveyed said that work was impacting their academic performance. Compared to, it was slightly less, 17%, where overall the institutions said that work was impacting their academic performance. And when I see students coming into my office who live in the Fraser Valley, there is that work-life balance struggle, where they're juggling how many hours of work, how many jobs are they juggling. So it's evident to me that there's a unique aspect of having a really hustle out here, hustle to kind of financially remain stable, to work, to provide for family. There seems to be this layering of responsibilities that students are coming in and talking about this, that where the stress is coming from. So when I think about some other unique challenges, I think about what students report to me in terms of traveling, the distance, and also mental health resources. Where are the resources out this way in the Fraser Valley comparative to downtown Vancouver or the Lower Mainland? And so bringing resources out this way and allowing them to support the communities and the families out this way as well is extremely important. I've found that, my last little comment, as I get the time indicator from Michael, is there was an analogy provided that really stuck with me. I just came fresh from the Healthy Minds, Healthy Campus Summit, which is put on by the Canadian Mental Health Association. And there was an interesting frog analogy. They said, what would we do if we had this, we observed these frogs in their natural environment in ponds, and they were getting sick. Some of them were dying. Some of them were acting different and becoming ill. Would we take a look at the frogs specifically, or would we do an environmental scan? Find out what's wrong with our culture, our community, government policy related to our youths that are struggling with mental health issues. So really culture, community focus in assessing that. Thank you.
Excellent, thank you. Karen Copeland.
Hi everyone. Is that on? I don't think this one's on. Hi everyone. Oh, that sounds better. I'm Karen Copeland, and as I was introduced, I'm the founder of Champions for Community Mental Wellness, which is an online resource where I share a bit of my journey to discovering how to shift my way of thinking about kids in our community. But I also create resources and tip sheets through collaboration with other parents, professionals in my community, educators. And so I guess the way I came by this is because I'm a parent. Now, in my previous life, as I like to call it, before I got married, I actually have a diploma in rehabilitation services in Alberta, which is developmental disabilities across the lifespan. And I worked as a behavior consultant, and I actually worked in the Alberta government as a case manager for persons with developmental disabilities. But none of that prepared me for parenting. And when my kids were born, my second child, we noticed right away that something was just a little bit different. And it was challenging to determine exactly what might be going on. It wasn't until he started school that things really started to stand out for us. And that began a whole long journey of trying to figure out what kinds of supports and services were available in our community, all the while feeling very isolated and marginalized because my child behaved in very unexpected ways. Now, you've all seen those kids in our community, and maybe some of you behaved in unexpected ways when you were younger too. And so what I actively advocate for is when you see those kids that are behaving unexpectedly, that you take a moment to pause and consider and reflect on the fact that there might be more going on than just a kid that's acting out or a bad parent. So, let's see, that's what led me to become interested in mental health. I navigated the mental health system for probably about 6 years, and then our son was diagnosed with autism, so we got bumped over to a different section of the ministry. In that time, it was challenging because we tried accessing everything, and Paul has seen a journey map that I created of all the services that we've accessed for our child, and it's pretty exhaustive. And the thing is that we were accessing all these things, and the focus became more on figuring out what was going on for our son than really celebrating who our son was. And so when I made that shift to determine what I needed to be doing was celebrating instead of focusing on all the struggles, things started to change for our family as well. Greatest challenges we face in the Fraser Valley. Well, I'm going to put it right out there that stigma is still the first and foremost challenge that we face. Again, going back to when you see a child or a youth that's behaving in unexpected ways, and you might wonder, why is she saying unexpected ways? Well, it creates a little bit of curiosity, doesn't it? Versus there's a child having a temper tantrum where we kind of form a judgment. Stigma is a big one. Access to services is a huge issue. And particularly if your child or a child is struggling with ADHD and any of its related companions like oppositional defiance disorder. And there's a real lack of services and supports available for those kids, not just within the mental health system, but within the school system as well, and their families. And it's interesting because in preparation for this panel, I belong to a few different Facebook groups, and I put out a post on one of the groups that I belong to saying, okay, I want to hear from families that have kids that have ADHD that are under the age of 12, because that's another area that I think we're really lacking in, is the services for kids under the age of 12. And the post exploded with comments. I can't even begin to tell you how many moms were coming on there and saying, I wish we could get access to service. We try, we get put on a wait list, or we get told we don't qualify. I hear from parents that have sat on a wait list for 2 years for an assessment. That's unacceptable. If we had a child that was diagnosed with cancer, would it be acceptable to make them wait for 2 years to see an oncologist? Absolutely not. So these parents are out there, they're struggling. They're asking for support, and we know that there's more that can support ADHD than medication. There's behavior therapy, there's social skills groups, there's a lot of different things that you can do to support kids that have ADHD, and yet medication is typically the first line of response. And what's interesting for me is when our son finally received the autism diagnosis, he didn't change. Nothing changed about him. He was still the same boy that we had grown up with, we continue to grow with. But all of a sudden, we had access to all kinds of support. We had access to funding so that we could provide occupational therapy, so that we could hire a behavior interventionist to come and work on specific goals with our son. We could hire a behavior consultant to sit down and help us develop those goals. But for our families that have kids who have complex mental health challenges, such as ADHD, anxiety, depression, those services aren't available to them. They have access to child and youth mental health, and don't get me wrong, that's an important service in our community, but we need to be doing more. And I want everyone to leave here today knowing that and thinking about the ways that they can advocate in your own community and to your government and say, we need to be doing better for our kids and our families, because what we're doing right now isn't enough. Unique challenges, as Tia said, the farther out in the Fraser Valley you get, the less access you have to resources. There are a lot of different groups that I could go and attend in Vancouver at BC Children's Hospital with my son, and I'm not willing to make the drive from Abbotsford. I'm just not. It's not worth my investment of time to make that drive in, not knowing how he's going to respond when he gets there. So we created our own resources, we created our own supports in our community, and we did the best that we could. And a lot of families are too, and especially out in Chilliwack. Like I said, the farther you get out, the more travel you're having to go through to try and access those supports. And what improvements are required for us to better manage youth mental health issues in the Fraser Valley? I think it really comes to shifting our perspective and our priorities and saying that our kids and our families matter. Thank you.
Thanks, Karen. My name is Paul, and I guess a bit of context for myself. I guess I'm here in my role as a leader of mental health clinicians, a team of mental health clinicians who work in Abbotsford. But as well, I'm sitting here as a spouse, I'm sitting here as a father. I have 2 kids, one in grade 11, one in her 3rd year at UVic. I'm an avid trail runner. My wife and I love running around Cultus Lake and Sunas Mountain and Key Peak, and we drag our dog everywhere we go, and he runs about 8 times more than we do every time we run. So that's a bit of context for myself, and maybe even an indication of what I do to stay healthy mentally and physically. But one of the questions was, what led you to become interested in mental health or become a mental health advocate? And as you could probably imagine, it's probably a combination of things. I would say it is for me, has been. And one of the first parts of it is that I myself struggled with a mental illness. At different points in my life, anxiety and depression have been part of my story. And in particular, in my 3rd year of undergraduate studies, went through a period where leading up to that, I'd always been the straight A type student. But I started to do poorly in my classes. I stopped handing in some assignments. I failed some classes and eventually dropped out. Took a year off, regrouped, and did a lot of things to get myself healthier. But that experience, probably more than anything, led me to have a greater compassion and maybe gentleness, not only with myself, but with other people I got to know along the way who too struggled. And it sometimes got to a point where, or it gets to a point where you really don't know what's going on or what it's going to take to move through this. And combine that with the family that I grew up in, which overall I'd say has been incredibly supportive and highly valued helping people. And so when you combine my early experience and then a family value of helping people, eventually it led me into finishing my graduate degree and getting my master's in marriage and family therapy and working as a family therapist and eventually doing the work that I do as a leader of clinicians in Abbotsford. Challenges, for challenges that face our community. I can speak anecdotally, I'll do a mix. I looked up the McCreary Youth Health Survey, and because I tend to work with people up to the age of 19, not over, McCreary Youth Health Survey has been really helpful for us in getting a sense of what the 30,000 respondents in that survey in BC indicated about their own mental health in 2013. And in that survey, we learned that the youth in BC come from increasingly diverse backgrounds. We see a rise from 2008 to 2013 in the number of recent immigrants to our community. We see a rise in the number of people who do not speak English at home. And we see a rise in the number of students who ran away from home in the past year, 9%. 9% of kids ran away from home in 2013. And that's grades 7 to 12 in the sample in this particular survey. 1% of students in BC are currently in some kind of foster placement, group home of the sort. Speaking to the resilience of those people, I would say that I was a little surprised when I read that 80% of youth, given all that, 80% rate their mental health as good or excellent in this survey. That's good, but there's 20% who said it was fair to poor. In fact, 8% of people who identified as males and 17% of females considered suicide that year. 3% of males tried, and 9% of females tried to kill themselves. So I don't think it would come as a surprise to you that in our work, in our office, take that little snapshot that I gave you, that we have seen over the years that it's become increasingly important for us to support the people who are supporting children and youth. And by that I mean that we found that if a youth or a child has a supportive adult in their lives who's attentive, attuned, some level of skill in helping them navigate the difficult life transitions, even like the ones that I went through, that those youth do better. So combine that with what I think are the increasing economic pressures on our families. The rate of poverty is, I think, abhorrent in BC. 9% of kids in this survey went to bed hungry because their family did not have enough money for food, and they were wondering where their next meal was coming from. So in our work, we have found that we've started to shift in supporting adults to be better at supporting their kids, and we've also shifted to providing more groups in a way to spread our effect over more people more efficiently. Unique challenges to the Fraser Valley, that's really hard for me to pin down. Again, I'm not a statistician. This is not my day job, is looking at the stats. It's more providing treatment. but I would say that Abbotsford and Chilliwack, my sense is that the days of our communities being perceived as little farming communities, suburban, nice outposts from the tough urban world, are long gone. The youth in our communities are facing the same kinds of challenges that youth have been facing in urban centers for many years. At least that's my sense. And even though I was also surprised to learn in the McCreary survey that overall rates of substance use and alcohol use have gone down in the last 5 years across the board, there's some pockets of our population, and Dave and I work with some of them quite a bit, where we're seeing substance use spiraling out of control combined with some very serious mental health presentations like psychosis, and it's become increasingly challenging for us to take care of some of those youth and students. So improvements, I completely agree with Karen's first thought. Reducing stigma, I think, would go a long way. Events like this help to that end. I readily tell the little bit that I've told about my story in settings like this because I want people to know that it's all of us who have these struggles at different points. There isn't a set of professionals that don't and the rest that do. I talk about these kinds of things in far more detail with my own kids. I don't hide the fact that I thought about killing myself with my university-age daughter. We talk about it when she's really stressed out and anxious about exams. I tell her where my brain used to go and how I dealt with it. I've met a number of parents who feel really reluctant to talk about what they went through when they were their kids' ages. And while there does need to be delicacy in how it's approached, and you can't put your need onto your child to meet, there is, I think, a lot of connection that occurs when you are transparent about what you have struggled through. So a couple more things. I would like to see an increase in the basic understanding of what mental health is in the general population. We need to take care of each other. The needs are far greater than any kind of professional agency or resource could ever meet. And so the more that you educate yourself on what healthy mental living is, the more supportive you'll be to people close to you. I'm going to say a few words that you need to write down. Kelty Mental Health. Just write down Kelty, look it up. Tons of resources. Mindshift is an app that you should have on your phone if you're ever anxious. And if you need to learn how to do mindfulness, get the Headspace app. It's a pay thing, but the first 10 are free. I get no kickback on this, but I have found so many of my friends, ranging from physicians in the community to just family friends, have benefited from learning mindfulness. And watch the movie Boyhood, would you? Anyone seen the movie Boyhood? There's a family that has struggled to get by, and it's on film. I know it's fictional, but it was tied in a lot of ways to the director's experience and some people in that film. Just a beautiful portrait of what the struggle looks like in an average family. Last two, reduce barriers to access when professional help is necessary. When money is tight, agencies like ours triage according to acuity. And so our services go to people who are in the most dire straits, and straits can get pretty dire that way. And then we offer more group services with greater funding. Services for less severe needs could expand. And I would say that models of providing those services are also shifting in some of the initiatives toward youth health centers and hubs. And finally, last thing, get more sleep. Please, seriously, get more sleep. Your mental health will improve with every hour of sleep that you get. The McCreary study showed that in their statistics. Your screens need to be off. I'm not bullshitting you, I'm serious. Your screens need to be off an hour before you want to fall asleep. And then they need to stay off until the morning. When you put a flashing light in front of your face, you wake up your brain. An awake brain doesn't sleep. That's it.
Thank you.
My name is Trish Lewis, and I am a high school counselor at Sarda Secondary School. I have been teaching in Chilliwack for the last 20 years. I've taught elementary school, middle school, and high school. And when the question was posed, how did you come to have a passion for helping youth with mental health, I think it became very evident early on in my teaching career that families struggled and children struggled, and teachers that I was working with were struggling as well, all with varying degrees of stress, life disappointment, hurt, pain. And it became evident to me that teaching was going to be more than just math and science and core subject areas. It was going to be life support, life navigation, understanding of self, and certainly navigating families towards resources for their journey with their children. So, like I said, teaching 20 years, I've met some amazing people in my time. I've had so many special privileges in the career itself. I am a mother of 4, and so that keeps me very busy as well, and also keeping you very humble before the work that we do. When you're a parent and you also have children and you're supporting children in your community, it is a very humbling experience because your own children have needs as well. Essentially, no one is immune from mental illness, is what I've come to understand. For myself, a life experience, my parents were both nearly murdered in a home invasion shooting in our town here many years ago, and I developed post-traumatic stress disorder from that. As you can imagine, being a Canadian-wide investigation and some tremendous details to that circumstance, left me feeling extremely vulnerable, and somehow I felt like I lost my foundation of strength. And with a degree in psychology, I thought I have lots of self-help tools, I should be just fine, but somehow I wasn't coping well and developing some anxiety and depression at the intensity of that extreme situation. And so I'm thankful, very thankful for that experience, because it led me to do my graduate degree in special ed, supporting children with special needs of all varying diagnoses. As well, I did my master's degree in counseling, and I've also become a registered clinical counselor with the province of BC and have my own counseling practice in town. And what launched all of that was this tremendous amount of empathy, understanding that you're not alone, no one is immune, and I think every human being walks a very fine line between anxiety and depression each and every day, very dependent on the circumstances or events around us. And so, to me, the number one objective was the stigma needs to be reduced. Nobody's immune. And so, much like all of us, none of us are immune from cancer either. But honestly, if you were diagnosed with cancer tomorrow, the community would wrap itself around you. Oh my goodness, how can we support you? How can we help you? And your family and friends and all of the medical agencies would be quickly establishing a plan, essentially to save your life and help you overcome. I feel that our mental health funds are very limited in this province and throughout the world, I'm sure. Also, I'm not a statistician, but I do feel that mental health is not treated the same. I see that with the kids that come to my office at school with quite a lot of shame and guilt and embarrassment. I think I'm struggling with depression. I just can't get over this sadness. I can't cope with any stress around me. Every event, I feel so anxious, and they give me their long list of symptoms. They're speaking of anxiety. And my number one response is, so you're human, and you're feeling unwell right now. It's no different than any other kind of sickness. We don't expect perfection from any other type of chronic illness. In recovery, why would we expect that of mental illness? So if they have had experiences with mental illness in the past, and it's come around again, that just means it's time to fill the toolbox again to avoid greater depths of mental illness. So when the questions were posed also, what do you feel are the greatest challenges we face in the Fraser Valley? Again, not a statistician like the rest of my panel is suggesting. What I do know is when I worked at mental health for my internship and my externship, what I noticed were wait lists, really long wait lists, which came to me as quite a shocking surprise how long. And seeing so many people in the offices working tremendously hard to address everyone's needs and trying to keep them supported while on that wait list. And I thought, there are not enough people. There are just not enough therapists and clinicians to support the need. I believe somewhere in there, the statistic where there were 5 or 6 therapists to 700 referrals a year. That's an impossible formulation mathematically. And so it became pretty evident to me also when I was on the board of directors at Ann Davis that our community has a need. And there are just simply not enough services available. So I think wait lists and access, there are barriers to access. Working at several inner city schools here in Chilliwack, it was easily noted that families just couldn't get to the services. Transportation, we have a poverty issue in Chilliwack, and I'm sure throughout the rest of the Fraser Valley. And I know the ways in which our schools are trying to address the poverty issues and mental health issues is by bringing in and collaborating with the community to have the mental health services available right on site. So at our school at Sardis Secondary, we have a drug and alcohol counselor from Chilliwack Addictions. We have 2 clinicians from Ann Davis right on site. And so rather than create the barrier that, well, we're going to refer you and we hope you get there, you know what, we're going to bring the services right here because you're with us 30 hours a week. We have the greatest access to bringing the service directly to you. And receiving a call also from hospice the other day when I had done my training there a number of years ago, the director called and said, how do we get grief counseling in your school? And so again, our services are finally collaborating at a community level and a school level to say, we have these kids, we have the youth 30 hours a week, we are the greatest avenue to access them, as well as their families. And so for a number of years, I was running the Parenting Anxious Kids group, and I was noting that there were 25 to 30 registrations every month. Anxiety is an issue. It's clearly an issue. And so the questions that were posed to us also led me to really try to solidify in my mind, why am I still on this mission? How do you channel this much passion for supporting people with mental health issues? And it's taking opportunities like today to say, we're in this together. There's a lot of people to provide services to. There's a lot of talented people that are working together to try and improve the services and increase access. I think one of my analogies too is when you peel back an onion and look at those layers, it tends to make you cry. When you peel back an artichoke, you get to the heart of the matter. And I hope that together our community can keep working together to help us all overcome the barriers that limit our youth and all of our families from accessing mental health services. Thank you for the opportunity.
So hi there, my name is David Bain. I'm a nurse, I'm a UK trained nurse. I've been in Canada the last 8 years or so. My background, has anyone seen the movie Billy Elliot? I was brought up in a kind of Billy Elliot kind of community at that kind of time. This is kind of mid-80s, lots of kind of social injustice in the UK, very kind of laboury kind of leaning. So that's my kind of background, which has led me into the mental health work that I've been doing for the last 24 or so years. Begrudgingly, I thank Margaret Thatcher for me entering into the career. I was on the dole, working in art centres. I was told that I had to go and do something. I went for a job in the local mental hospital, and I've kind of carried on in that work ever since. I started off in the very back end of the wards, where I was working with the very severe and enduring long-term inpatients, and gradually through my career, I've moved further and further upstream to try and treat people earlier on in their mental illness journey. And it has been, kind of walking upstream with a strong current coming down as you try and get to the kind of the source of the river, never yet making it. I continue to work with the severe and enduring mental illness within the youth and young adult population. And I think the nature of my kind of work around advocating for this population is, as a nurse, I'm very hands-on, I'm very pragmatic, very practical, and kind of do what needs to be done. I struggle with our programs that we develop by the very essence of the name of a program. A program implies that you come in, you do the program, and this is the end result. I come from a place where we provide services to people who have severe and enduring mental illness, and in providing that service, you actually are serving somebody, you're assisting them in a very different kind of way, very different manner, very hands-on, very practical. One of the challenges that I also see is that we've got some great counsellors, some great experience, some great psychologists, psychiatrists, all this great kind of therapy work, talking work that we can do. We can guide people, we can shape their recovery, but we need to walk alongside them to take them through that recovery, particularly when we're working with people with severe and enduring mental illness. One of the challenges is you can direct them to service, direct them to do this, but unless you actually walk with them to those services, to those programs, acknowledging that the nature of a severe and enduring mental illness is that it does impact your ability to function, it doesn't impact your motivation, your ability to undertake these very practical steps in your recovery. Maslow's hierarchy of needs says we need to have warm food, shelter, all these kind of things before we can move up and consider, why am I where I am today? How can I, kind of change my circumstance? How can I be more? And if we don't deal with those fundamental things first, how can we expect people to make recoveries from their mental unwell situations that they find themselves, and how can they promote their own recovery? So I very much come from that hands-on, let's get in there, let's roll up our sleeves, kind of get mucky, help people very practically by engaging them first of all. I think we need to build relationships with people who are experiencing mental illness. The other piece is we need to be finding them much, much earlier. What I find within the work that I do with early psychosis clients is that I know that if I get a particular referral from a particular cultural group, I know the chances are that person's going to be very unwell, and has probably been unwell for quite some time, because those cultural groups in our society don't come forward and get help early enough. And it's about recognizing what those challenges are for them to either recognize the fact that somebody is actually living and dealing with a mental illness, or to overcome the stigma of acknowledging that they have a severe mental illness that does need some help and support. Then the job is, I often see my job is kind of selling schizophrenia in some respects. It's this dirty thing that I've got to try and persuade somebody, encourage them to accept and acknowledge this is what they may have. How do I do that? I have to do it in a way whereby we're actually explaining what causes mental health concerns, what causes mental illness in general, moving away from disease models and kind of bad neurochemistry, but looking at what are the basic things that kind of lead people to kind of struggle with mental well-being, and then when they become ill, to then work backwards to help them to acknowledge, understand that, and to put in place those things to protect them. So when it comes to kind of challenges we face here, I've been around BC and I've looked and reviewed different mental health programs in different regions, and I compare this region out here to some of the very rural places, in northern BC, on Vancouver Island, for the accessibility of services. At the same time, we have, as we mentioned, some of these very significant inner city kind of challenges around deprivation, around unemployment, around substance use, which makes it very, very challenging as well. So I think when we're looking at kind of how do we better build our services, it's about kind of diffusing them through our kind of community services out there. When we have these silos, we have all these different ministries, different organizations, be it the Department of Health, be it MCFD, be it education, be it all of the kind of community contracts that are out there that are all doing discrete little bits of work. We somehow need to be better in the way that we can work together. I've been at care team meetings with like 15 different partners at the table, providing service to one client and their family. And how can we do, all those people do that work in one coordinated way? It becomes very challenging. So I think the way we communicate between services needs to improve significantly. Primary care, just accessing like kind of family doctors. There are so many of our vulnerable members of society who can't access these resources readily. I think as well, when we're looking at kind of providing information in the community to really enhance the early recognition of emerging mental illness, the challenge that we have is that we then start to identify more and more vulnerable individuals. How do we then serve them? Resources are very clearly an issue. If we look at the fact that by the time someone hits 14 years of age, more than half of all major mental disorders have already found their their kind of place. We look at the actual proportion of health resources that go on mental health issues. Across the World Health Organization, 27% of the burden of illness across the world is mental illness. Across the world, barely 3% of the budgets of all health resources go to treat the 27% of the burden. In first world countries, we're looking at probably about 9% of our health budget goes on treating mental illness, which still accounts for almost 30% of the burden of illness in a first world country. So the very disproportionate amount of resources kind of spent. How do we overcome some of these challenges if, when we're going to go out and proactively support people in recognizing emerging mental health concerns, how do we then service that population who may then identify? There are lots of great online resources, but again, I come back to the point that you need to have someone working alongside of you, walking alongside of you, who you can access 7 days a week, who you can, kind of actually be able to go and actually attend those appointments or have those individuals kind of come to you. I come from that kind of parental model where you need to look after the most vulnerable members of society. You can't expect them to self-recognize they have an issue, recognize the challenges that the illness itself may cause them, and then somehow expect them to turn up and seek treatment on their own and actually follow through on those recommendations. I often see my role as protecting adolescents' brains, recognizing that mental illness does have an effect on the functional kind of abilities of the brain, recognizing that if you have some capacity issue, you probably need extra support and help to achieve your recovery. You need people to walk that recovery with you. And that's certainly the place where I feel we need to be better at kind of considering our clients from, that they need us to walk alongside of them. We can't expect them to take this journey themselves. Thank you.
My name is Tasha Couture, and I am a group facilitator at Chilliwack Secondary School for a group called Youth as Gatekeepers. A little bit about me, because I'm only 21. I don't have a lot of experience being in an office and dealing with mental health as like a doctor or a counselor. However, I do have my own experience that led me to be where I am. And that would be that about 9 years ago, my grandfather had a stroke. Now, when this happened, this was the very first time I'd ever heard anything of a stroke. I'd never heard that term before. I had no idea what it was caused by, and what challenges it could bring. Challenges including our mental health system. So with that experience, I spent 9 years just being present and observing the mental health system, how doctors interacted with their patients, how nurses interacted with their patients, how other people just coming in and out of the hospital would interact with you, knowing that you were a patient in the hospital. You were there for a reason. However, I was never directly affected by the mental health system until about 5 years ago, as of this past November actually, when I was 16 and I was in a fatal car accident on the highway. In this car accident, my best friend that I had grown up with since I was a child had actually passed away. So this led my own mental health journey, dealing with depression, anxiety. I suffered from body images, I guess, in an eating disorder sense. I've also dealt with my own suicidal thoughts. Now, this is where mental health started to direct me personally. Where do I go to get help? Who do I talk to? Can I talk to my family about it? How are they going to react? Because they grew up in a different time than I did. My mom suffers from mental health issues at the time, but even though she was suffering with her own problems, be it depression and anxiety, the fact that I was 16 years old and now suffering from depression and anxiety wasn't something that made sense to her. I was too young to be dealing with that problem. Because of that, I then stumbled upon Youth as Gatekeepers, and that is a mental health advocating and literacy program. Its job is to teach you the resources in your own community so you can seek help. To me, that was extremely powerful, because not only was I being able to aid people with help, I was also getting help and seeing how it felt to receive the treatment that I needed. So be it that was my experience, the greatest challenge that I can see personally would be education and communication, not just from the medical professionals, but from the people in our own community. Not a lot of us, or not us particularly, but not a lot of people know about mental health. Not a lot of them know the resources, the symptoms, what it's really made of, how many people it can actually affect. So education, to me, would be the biggest challenge. We have youth in our community that are dealing with mental health, but there is a huge barrier of stigma and just unknowing that this is actually happening. As a group facilitator, I help the youth in Chilliwack Secondary School create a presentation on various mental health illnesses such as depression, anxiety, psychosis. And we go into the schools in our community and we present them to the youth. We don't present them being, this is psychosis. It's very terrifying. We present it as, this is a mental illness. This is how it can happen. And these are the resources that you can see if somebody that you know or someone like yourself is suffering. What resources are available to you? Who do you talk to? What do you do when you first recognize that there's a problem? A question that I ask every single time I start a presentation is, how many of you, this be it the students, have endured a sexual education presentation? And for the majority of them, all of them raised their hands. Then I asked them, how many of you have endured drugs and alcohol, the DARE program, on resources, what can happen to you when you go through drug abuse, alcohol abuse. They all raised their hands. None of them raised their hands for a mental health illness presentation, based whether it's just information or resources. None of them. They don't get that in schools at all. And to me, with suffering on my own journey, how is that not something that is available to our community? How do the students in our community not know what these illnesses are, how it can affect them and where to go? How do they not know what to say when their friend says, I feel really depressed? And they mean it because they have depression. Nobody knows what to say. Nobody wants to talk about it because they don't know what to say. They don't know what's appropriate. They don't have the education behind them to say so. Because for me, mental health is very personal. It's something that I struggle with even to this day and even right now. To me, I feel like my answers are a lot different than the other panelists because I'm not coming from a university background saying that these are the issues that I have seen other people with. They're issues that I've struggled with personally myself. I know how it feels to have depression. I know how it feels to have anxiety. I know how it feels to have suicidal thoughts. But I also know how it feels to not have anybody to talk to. Not even my family members know what to do or say. People that I've known for years, upon years, don't even know what to say. Hi, how are you doing? Well, I'm okay, I guess. Okay, great. What do you want to do today? And that's the end of the conversation. They don't even want to touch why I'm saying, well, I'm just okay. Because in their minds, they're thinking, what if she has depression? What if she's depressed right now? How am I going to handle that? I don't know what to say. I don't know what to do. So for me, education is key. Education and communication. Educating ourselves about the resources in our community, who we can go to talk to, who's there to help us, or even just knowing ourselves what we can do, what we can say, how we can handle the conversation, because that's the first step, is I have a problem and I need somebody to talk to. So if you think about it, you are the first step for somebody who has a mental health illness. So what are you going to say to them? How are you going to educate yourself? And that's all I have to say.
Excellent panel presentations. I think we'll all agree on that. We are running a little bit late on time. It's close to 1. I know some of you probably have classes. But it would be great if we could have a couple of questions, and if you could stay, that would be excellent, and we'll extend this talk time maybe 10 minutes or so. Go ahead.
So I have a 13-year-old daughter, and everything was fabulous and bumping along swimmingly until November. And so at which point I found out she quit her sport, which she was actually an elite athlete in her sport. And she lost interest in that, her grades dropped, I found out she was cutting herself. So I was completely blindsided. And so just from her school perspective, because I put her in counseling immediately and tried to connect her with a counselor there who has 600 students for one counselor and a million teaching blocks, and she has to do TA stuff as well because the funding has been totally cut for their counseling department. And so just hearing from my own child how like this is a rampant problem, and she said herself, why don't people come to my school and talk about this? Like, I know so many people that have these issues, and so like just as how do you get that in to the school? Like she said, there's a million speakers that come and talk about bullying and drug and alcohol and this and that, whatever, but she said there is nothing. Nobody wants to talk about it.
One of the things that I think being English, I think we're really good at complaining. It's the weather, it's the sport, it's everything. One of the things that I've noticed since coming to Canada is you guys don't complain about anything, least of all your health service. And I find that it's by complaining, sort of outside of the immediate health system that actually things start to change. It was not uncommon for me back home to get phone calls from the local MP, from the MLA, from the councillor, from the chief executive of the social services department to say, this client, this parent has been into my office, has been kind of asking, why is this the way it is? And it's often through those kind of complaining things that momentum can kind of gather. I think, whether it's because we look over the line and actually see what the American healthcare system is, that we're so thankful for what we do have, that we accept it, rather than complaining about how it could be improved. And I think it's that complaining culture that makes things happen. I know that things change for clients when they complain. And I think that's the only way we can, as a system, enhance and improve the resources that we have, is to go outside and complain about, we need X, we need Y, we need Z, why is this not happening?
I think David has a really good point about kind of making change at the systems level and the policy level, but I also wonder about the amount of hours that our youth and our children are spending in the classroom. So starting at the level of an instructor or a teacher in the classroom, incorporating something about mental well-being or general well-being into the class. And I'm not talking to have a whole hour, or I know the time's limited, but how about a 5-minute check-in at the beginning? How about just reviewing a checklist, each individual student a checklist about where you're at with your mental health, a self-awareness check-in. At the university level, there's been some mental health strategies incorporated into classroom where instructors will be having a mental health day where the students will have a day not to come to class, with the acknowledgement that the intention is about balance and well-being and mental health. So at the level of the classroom where youth and children are spending their time, there needs to be, like Tasha said, that education, that acknowledgement.
I'm sorry. Just really quickly, middle school. And I think we do a really good job going into our secondary schools. I think there's more uptake in the secondary schools, but it needs to trickle down into the middle and the elementary schools. Having those relationships with your teachers, connecting with educators in your community and saying, hey, this is a need, how do we make this happen? How do I partner with you to make this happen? That's some of the work that I'm doing with my organization.
And as the mic moves over, one book recommend, Helping Teens Who Cut. Dr. Michael Hollander, Harvard psychologist, wrote this thin paperback for parents, and it's really just ideas of how to support a kid who's going through that.
Thank you. I appreciate the concern that you brought forward because we certainly feel the pressure in the school system. I was an elementary counselor, and it is a systemic issue for sure, and it is an opportunity for parents to attend our school board meetings, to share there very publicly the concerns that you have as parents. Philosophically, we sometimes have to promote that our triage counseling that we do at the schools is very different than long-term therapy, and I definitely know and see and understand the difference in what I'm able to provide in private practice ongoing with my clients versus in the school system triaging their needs throughout the day, and yes, by the hundreds, of course. And so definitely systemic, and like David said, speaking at a higher level. For the schools, I would suggest certainly attending the school board meetings and trying to present your concern, having a relationship with the administrators of the buildings and sharing your concern there so they too can voice their concerns at their administrative meetings as well. I think quite proudly, working for Chilliwack School District in the 20 years I've worked there, both elementary, middle, and high school, it's very encouraging to see the differences that are starting to happen. We are doing more at the classroom level. Please have an understanding too, on behalf of all my colleagues too, that these are teachers who came into teaching in their areas of passion, their subject matters of passion, and or age groups of passion. And so many of them have come to me and said, you know, Trish, I'm not a mental health expert. You took that specialization. I'm a teacher and I teach math, or I teach science, English. And so remembering that teachers are overwhelmed with the complexity and diversities we're starting to see in the classrooms, with more diagnoses as well and an increase in mental health needs. So we're also asking on occasion people who aren't feeling that they can take on this curricular area. But we are seeing at professional development days more and more in service on how to support kids with special needs and mental health concerns. And so at a pre-service teacher level, those training to be teachers, we are hoping for more and more training at the pre-service level. And so I was privileged to be a guest lecturer last year and this year at UFE in the teacher education program, to be able to speak about, as teachers, how to support children in the classroom with mental health concerns. So we're on our way. We're on our way. It's coming, and it's a big systemic push, and it's going to certainly take some time and some strategic planning.
Another question?
You've talked a lot about supporting youth that already have mental health issues, but what happens for the youth that maybe don't develop mental health issues in middle school or high school, but then hit university and bam, just like a slap in the face? How do you think we can develop their sense of self-help tools in lower ranges, but still making them aware that mental health is an issue, even though they personally may not have an issue at the time?
Do we want to lead on that?
Well, I think it goes back to the education in schools first and foremost, which doesn't help the youth who are in post-secondary school right now, but it can in the future. Just being aware of the different mental health and wellness tools that are out there, like mindcheck.ca, which is developed for youth by youth, the Speak Up program, and teen mental health program, where you can actually go online and learn more a bit about the different signs and symptoms. Mindcheck.ca is a great website for that, and I just encourage all of you to check it out, because it would be geared towards your age range, or most of the people in here anyway. And I think there's more on-campus mental health awareness events happening too, is there not? I think I've been seeing something like that going on.
I think that from our counseling department standpoint, we do as much as we can in terms of our mental health screening and education day. But I would encourage each one of you to think about creating a club, association. We have a mental health awareness club here at UFB. We have a lot of student union energy and strategies that are honing in on kind of education, support. So I would say peer-to-peer is the most powerful. And in a counseling position, I'm appreciating my effort needs to go more and more to supporting students in their role to support each other. And so definitely we need more resources here, but I think you can begin that shift a little bit by coming together and thinking about creatively, what do I want to do on campus? What can I do with the time I have? Who can I collaborate with?
And I'll also put a plug out there for mental health first aid. The Canadian Mental Health Association has developed a training, and approved trainers offer this. Varies, I think, from 1 to 2 days worth of training, where it's just open to the general public for you to learn how to support people who are struggling with different mental illnesses.
I was going to say, it's certainly a continuum in elementary schools, having our child and youth care workers offering coping skills groups and resiliency groups, all the way up through middle and high school. As well, Youth as Gatekeepers resides in our building as well, so 20 to 30 kids every Monday getting together and really championing for that cause, to say we're here to reduce the stigma, and we're going to work together to really profess that nobody is immune from mental illness, and that we can support each other openly, honestly, and not have to live in the shadows of our illness behind closed doors, thinking that the support is not there. I was also going to mention anxietybc.ca as an excellent resource for those struggling with anxiety. Great resources online.
And I think there's just that aspect of just kind of challenging people's attitudes as and when they come up. You know, I think we have to recognize, you know, kind of 1 in 3 of us at some point in our life are going to experience a significant mental health concern that we're going to need to seek some help for. And I think if we, you know, start to make people feel like they have to hide in the shadows because they're experiencing these kind of things, whereas I think if we can come forward and we can start to challenge people's attitudes when they bring up those crass, unwarranted, unnecessary, humiliating, derogatory comments, to start to question those and to start to change the values and the attitudes that we have about people who are experiencing mental illness. Because all it is just a question of time before it's our turn. And would we want to be treated in that way when our turn, you know, sort of comes around? And I think if we can think about it in those kind of terms, then I think we're a bit more respectful towards other people and appreciate the distress, the discomfort, the real challenges that individuals have as they deal with any kind of mental illness.
Yeah, I think unfortunately we reached the end of our time for today. I want to definitely take the opportunity to thank our wonderful panelists today. Let's give them a big round. I know a lot of you have to go to class, but I'm sure there'll be a few minutes for questions for some of the panelists who have a few more minutes to stick around. So if you have more questions, I'm sure they'd be willing to answer them. Thanks very much for your attendance, and hope this is really different. Thank you.